Well, there's two types of diabetes in pregnancy. There's diabetes that a woman has before pregnancy, like type 1 and type 2 diabetes, and then there's diabetes just that occurs during pregnancy. So I'll talk a little bit about what we call pre-gestational diabetes, or this is women that have type 1 and type 2 diabetes. This complicates maybe 0.5% of our pregnant population. These are high-risk women, and the main message here is that they should have excellent sugar control before they get pregnant. The more common type of diabetes in pregnancy is the form that's just confined to pregnancy, so that's called gestational diabetes, and that will affect between 5 and 10% of women. So these are healthy women. Later in pregnancy, diabetes is diagnosed, and then after the pregnancy, the diabetes then goes away. Now, the sort of women that are at risk are any woman that has a family relative with type 1, any type of diabetes, certain ethnic groups, people from Asia, South Asia, Africa, Philippines. There are very high rates of diabetes in pregnancy in those groups. And women that are overweight and obese is a particular risk factor. Older age as well is also a risk factor in pregnancy, and you may well be aware that the average age of childbirth in Ireland is increasing. So we're seeing more ladies who are older. So these are the risk factors, and as you can see from that list, some of these risk factors we can modify, but many of them we can't. So if we look at the ones that we can modify, in fact the overweight and obese one is probably the only one that we could modify maybe before pregnancy or during pregnancy. So looking at diabetes in pregnancy, what causes it is as the pregnancy progresses, the demands of the baby and the mother increase. And this leads to a transient type of diabetes. It usually comes on in the last 1/3 of pregnancy, and then afterwards the sugar control goes back to normal in the majority of ladies. Now, the implications it has for the mother, of course, is it does put her at increased risk of type 2 diabetes in later life. So if we look at ladies that have gestational diabetes, half of them will go on to diabetes in later life. And so the implications is more for the woman's health, that it gives her a little preview into later life, that she's at risk of diabetes, and if she modifies her lifestyle, increases exercise, has a healthier diet, a more normal weight, she will reduce that chance of later life diabetes. In terms of the baby, there's some evidence that the higher sugars associated with this gestational diabetes may encourage fetal overgrowth or a propensity for larger babies. So it is important once it's diagnosed that we manage it. Now, how do we manage diabetes in pregnancy? It's all involving in lowering the blood sugars. So this is mainly through diet and exercise. So choosing foods that release sugar slowly into the bloodstream. So brown bread, eggs, vegetables, porridge, these are foods that avoid peaks in sugar. So for many women, we'll say more than 50% of women, they will be able to manage this transient pregnancy diabetes with a good diet and regular exercise. So exercise actually lowers blood sugars. So exercising once or twice a day, 30 minutes per day, plus a low sugar diet will be appropriate for most women. For some women, it isn't enough and medication is needed. For these women, it's a tablet or insulin injections, so for a small number of women. So it is quite an important condition in pregnancy. It's quite common, affecting 5 to 10% of pregnant ladies. It's increasing all the time because our ladies are more overweight and obese than before. They're a little bit older, and we're seeing larger numbers from those at-risk ethnic groups. But I think the message here is for anyone planning a pregnancy or in pregnancy to keep an eye on their diet, avoid excessive weight gain in pregnancy. Keep an eye to avoid those sugary drinks and foods, and that should go some way to reduce their own individualised risk for developing gestational diabetes.